Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Of course, thanks for having me.
Absolutely. My name is Dilshad Burman. I'm a writer and reporter with City News and City News 680, and I will be moderating this chat today. Now, the way it goes is we've been collecting your questions over the past week for the doctor. She hasn't seen them before, and we're going to present them to her today. It's all off the cuff. If you haven't had a chance to submit your questions, you can still do so in this live broadcast, in the live chat, and we'll try to get to as many as we can. Now, this week's topic is COVID-19 booster shots, that third shot that we're talking about. We've had tons of questions about this, so we said, let's make it the topic this week and let's get all your questions out. We're going to start with our submitted questions and some aggregate questions that we've had over the past several months, and then we'll take live questions as they come in. So, Doctor, whenever you're ready.
Yeah, I'm ready. Yeah.
Okay, so we'll get started. We'll start with Sridhar's question. Sridhar asks, no worries.
Yeah, go ahead. Yeah, no, go ahead. Yeah, just
okay.
See my camera. Go ahead.
No problem. So Sridhar asks, now will booster shots be made widely available for anyone who got their last shot more than 6 months ago, or will it be restricted to specific demographics or based on the previous vaccine that a person has gotten, like AstraZeneca or J&J?
Yeah, it's a good question. We don't actually have the full answer to that question just yet. You know, the province of Ontario has certainly laid out their vaccination plan, where they've noted that in the new year, boosters may become available to all adults. There certainly is no recommendation right now from the National Advisory Committee on Immunization. So we'll just have to wait to see what, you know, kind of who will be next for the booster dose recommendation. Even now, for those who have been recommended booster doses, like, for example, if you had 2 AstraZenecas or are a senior, 70 years of age and older, most even of those groups are not eligible yet. It has not been 6 weeks since their last dose.
6 months.
Sorry, thank you. 6 months, yes.
6 months, okay. Okay, and then let's go to Margot. Margot asks, why do we need a booster shot? According to the research, 2 doses would be enough. So why are we having a booster? And are we then going to have one every 6 months?
Yeah, so we don't, again, know the full answer to that. The reason why some groups are being recommended a booster dose, like 70 plus, is because that is the age group where we're finding if they get COVID, they may have a smaller, not high, but a smaller chance of being admitted to hospital or getting very sick from the infection. And so there is evidence that, especially in those older age groups, that there's waning of immunity. I mean, that's not uncommon. We know that as you get older, your immune system slows down, is a bit less robust. And so that is why the booster doses are being recommended. It's to provide that individual level protection for people who may have early waning of the vaccine.
Right. I don't think we have had enough third shots to answer this question, but I'm going to ask it. Smith asks, what percentage of the hospitalized and dead did not have third shots?
So if you look at hospitalizations and deaths among those who are vaccinated, it's very, very small. And if you look at those who, it's actually mostly based on age. So you'll see in the 80 plus in Ontario, very small percentage of people who are vaccinated who end up in hospital or who may even die of it. Now, I don't know what percentage of those have had booster doses. I just know that they're recorded as being fully vaccinated. Again, though, the largest proportion, even by age, is among the unvaccinated.
Right, okay. So Henry asks, now we've got a booster shot, and I guess we've already answered this question, but again, the ongoing question basically is, will we need more booster shots down the road? Will it become, say, yearly like the flu, or every 6 months, or every 10 years like the tetanus shot?
Yeah, we have to wait to see what the coronavirus does. I mean, we've seen actually multiple variants spread even within our own city, even within our own province, right? Where we had in wave 3, the Alpha variant before that, different variants that were present. In fact, in the spring, we had 3 variants that we were thinking about, what we had previously called the Brazil, the South African, and the UK variant. And then we had heard about this Indian variant, which is now called the Delta variant. Right. That Delta variant has really taken over. That is our predominant variant right now. But we're not sure. Could there be another variant down the road? And we know that each variant responds differently to the vaccines. Right now, they have all had protection from the vaccine. So that's part of what will determine whether we need to have booster doses, for example, into the future. We saw, for example, in 2009, we had the H1N1 flu pandemic. And thereafter, we didn't need a pandemic vaccine, but the annual flu shot has had that H1N1 strain in it since then. So yeah, unfortunately, it's really hard to predict a year from now where we will be with this virus.
Right. Let's jump into a live question actually that just came in from the website. And Chris asks, would those with type 2 diabetes be recommended for a booster shot?
So right now, if you have a chronic health condition like diabetes, for example, you are not preferentially recommended for a booster dose. It's really just if you have a severe immunocompromising condition or on really the immunocompromising medications that you would be eligible, or based on your age, if you're a diabetic who's 70 years of age or older. But again, more guidance to come on that as the evidence is being reviewed.
Right. And doctor, is that the same for those with severe asthma as well? Because I know we have that question later on.
That's right. Severe asthma, really all other chronic health conditions, there hasn't been a recommendation that they get a booster dose. Now, you have to remember that, if you have severe asthma, it doesn't necessarily mean that your immune system won't develop a good response to the vaccine. Right. So that's part of what we're dealing with, is that the people who are being recommended a booster dose, for the most part, have had a waning of their immunity. Now, the exception is healthcare workers, but that's even in healthcare workers, a lot of them had the 2 doses with that very short interval, like 21, 28 days, which we know may lead to a less high response after that second dose.
Right. More live questions coming in. Let's take this YouTube question from Red Reaver. Why are we seeing so many COVID spikes in highly vaccinated provinces and other countries? Is it driven by breakthroughs or the small amount of the unvaccinated people?
Yeah, I don't think that many countries have that very, very high levels of vaccination. Like, I think that's what we really have recognized. That's why in Toronto, our goal is 90% with 2 doses. We've hit 85%. Still not at 90. And so it's really the recognition that this Delta variant, very transmissible. And so even at population rates of 75%, 80%, like some of these European countries, it's not high enough to have that community immunity, that herd immunity, especially recognizing that 11 and under don't have a vaccine, and they often make up a sizable portion of the population. Right. So by and large, it's the unvaccinated. It's really that you need very, very high vaccination rates. And even still, you may have pockets where the vaccine can still spread.
Right. Okay, we're going to take a few more live questions. They're not directly booster related, but that's okay. And from YouTube, Miss Jackie asks, do you know when the J&J vaccine will be arriving in Ontario?
So I don't know the exact day or time that it will be arriving. Right now, my understanding is that it will be available for people who have allergies, medical contraindications to getting a messenger RNA vaccine to start with.
Okay. And then let's move on to some more questions coming in from YouTube here. Let me take Ruby's question. Should we get it as soon as it's offered to us in 6 months? I'm assuming this is the booster dose. I have asthma and I got my second shot 3 weeks after my first one. And then I learned after that it was better to wait at least 4 weeks to get better immunity?
Yeah, so to get the booster dose, it's not that real urgency to get it right away, like on your 6-month mark, because really you have immunity and then it's kind of a slow wane. So you're not going to drop off a cliff with your immunity. And so again, that urgency is not there to get it right away when you are eligible. So that's one thing that I think will help to allow people to feel a bit more confident, like if they can't get an appointment right away. I think where it is really important to get that vaccine right away is if you have not been vaccinated, for example, or for children to get the vaccine, the 5 to 11-year-olds, when we have that vaccine available, because they have zero protection right now.
Absolutely. And then, okay, let's say this is again not a booster dose question, but we're going to take it. Jorlando asks from YouTube, there are reports that COVID-19 tests are going to be conducted at pharmacies, symptomatic COVID-19 tests. So how is it possible to have screening at pharmacies, because people are going to be walking in, with symptoms to be tested? Isn't that that's a bad idea, because customers are there, staff is there. If somebody is symptomatic, they're going to spread COVID-19.
Yes, so my understanding is that in order to offer this test to symptomatic people in pharmacies, they will have to have what we call those infection prevention and control measures in place. So similar to, for example, when you go to an assessment center, people have symptoms, they go there to get tested. They will have to have those controls in place to prevent the spread of COVID in people who do have symptoms.
And doctor, what are those controls? Is it like separate entrances? Is it, distancing, all of that?
Well, not necessarily separate entrances as a requirement. I mean, that's always nice, but things like ensuring that masks are worn, that there's physical distancing, a separate room, a room where the swab is going to be taken has good ventilation, for example, that the people taking the swab are wearing the proper PPE as well, for example.
Okay. And then this is a question we get a lot, so we're going to take it because it's a live question coming in and we've had it submitted over the week. Will the booster doses be required for your COVID passport to remain active?
Right now, the booster vaccine doses are not a part of the vaccine passport system.
Okay. Let's jump back into our submitted questions here. Wings asks, the side effects of the Pfizer booster shot were less than the second shot of AstraZeneca. So it looks like Wings has had their third shot. It was mostly injection site soreness and sudden fatigue on the second day. Are there any studies about the protection duration of the booster shot? How long will that last?
So it's great to hear that Wings got their vaccine. Wings, as you tell me, is a regular contributor.
Yeah.
Sounds like had 2 doses of AstraZeneca, is eligible for the third dose 6 months after that second dose. Again, the booster dose is just recently licensed, just recently started, so don't really have that long-term information on how long will the booster doses last, because that's another question, right? When you get your third dose, maybe that might last for several years and not need an additional dose after, because that is part of the questions as well. We do know that the side effects from the booster dose tend to be less. Again, that spacing between that 6-month spacing often means then that the side effects will be less between the 2 doses as well. So you really can't go on your symptoms to decide whether to use that as an indicator for how long your immunity will last.
Okay. Let's jump into some more live questions coming in from YouTube. Anand asks, are there any Canadian pharma companies working on a vaccine, or do we have to rely on doses from other countries?
Well, Medicago, which is a vaccine company based out of Quebec, does have a vaccine that's in the pipeline. Has not submitted their vaccine for approval to Health Canada yet. Maybe the trials are ongoing, but that is a Canadian company that we can look out for.
Right. Okay. Let's take one more YouTube question coming from, I don't know if I'm saying this right. Primakin asks, so they say the active case count in Ontario last year today was 12,932. The active case count today is 4,741. So we're in much better shape this year than last year. So why the panic?
Oh, it's not panic, but it is certainly keeping a close eye. I think if you think about last year at this time, yes, we had so many more cases. We also were hardly mixing and mingling, right? Like there were a lot of things that were closed or that were about to close at this time last year, end of November, for example. And we had many more cases in schools even, for example. So I think the reason for caution is really that the weather is getting colder. I think there's snow advisories in parts of Ontario today, for example. Yeah. So we're going to be more indoors. We know the virus will spread more indoors. And so that's really, why. And we're mingling more. We're out and about more. And so again, going indoors and having that more close contact with people is why the virus may spread more in the coming weeks or months ahead of us. And that's why we really have to take a cautious approach, especially also looking at what's happening in Europe, where there were countries like I was reading about Spain had very good control of the virus, and now it has taken off. And so that's the reason, not for panic, but certainly for caution as we approach these coming weeks.
Right. More live questions coming in from YouTube. Again, Miss Jackie has a follow-up. If you are living in Ontario, but you happen to be in another province, can you be vaccinated there, and will your information be valid in Ontario?
So if you were vaccinated in another province, yes, you can get that record acknowledged in Ontario, and it is the same vaccines, again, that are being given across the country. And so there is a way to get that vaccine included into the provincial registry by contacting, for example, your local health unit to do that.
Okay, let's jump back into our booster shot questions. This is something that we've heard a lot, doctor, so let's address this. Elsa says, real vaccines don't need 3 different shots. Can you clarify this? Is it that vaccines are supposed to be one and done, and there's something different about this vaccine? That's something that we've really sort of seen a lot of.
Yes, there's no question that some vaccines require 3 shots. Some require more. If you think about when you're an infant, you actually get diphtheria, tetanus, polio, pertussis, Haemophilus influenza B. That's a 5-in-1 vaccine. You actually get 5 doses in your first couple of years. Yeah. Measles, mumps, rubella, you get 2 doses. Hepatitis B vaccine, most people will get 3 doses of that. Hepatitis A, 2 doses. So, the second dose is often that booster dose. It actually boosts the response to your initial vaccine dose. To really, the goal of the booster doses is to try and give you more of that lifelong, if possible, that longer term immunity. And so, no, vaccines are not always a single dose series. Right. Tetanus, we give boosters every 10 years, for example.
Exactly. And that's kind of lifelong, right? Tetanus, you just keep taking it every 10 years. It's not something that they say, okay, once you hit a certain age, you stop taking it.
Right now, that is the recommendation every 10 years for that tetanus vaccine.
Right. Okay, so that's it for live questions for now. We're going to continue with our submitted ones. Is the 3rd shot of the vaccine exactly the same as the other 2 shots?
So for Pfizer, yes, it is the identical vaccine. For Moderna, it is for some people, a smaller dose. So the Moderna dose that people get for their first and second dose is 100 micrograms. And that 3rd dose at 100 micrograms is recommended if you're 70 years of age and older. Okay. If you live in a long-term care home, for example, or you have a weak immune system. But for everyone else, like, for example, a healthcare worker who may be 35 or 45, getting that booster dose, it's the half dose. It's 50 micrograms of Moderna. Same vaccine, though, just a smaller dose.
Okay, and so then, doctor, what happens like for somebody like me? I took Pfizer for my first shot and Moderna for my second shot. If it is recommended that I take a third shot, what shot would that be? Would that be Pfizer or the half dose of Moderna?
You could get the Pfizer, which is 30 micrograms, or the Moderna 50 micrograms.
Either one. Okay. Okay.
Yeah.
And then let's go to this live question coming from YouTube. Jorlando asks, any reports of issues with the seasonal flu shot and the double dose of the COVID shot?
So I'm not sure about the double dose of COVID vaccine. Maybe you're referring to the higher dose Moderna, the 100 micrograms, if you're 70 plus.
I think they mean the two shots, like you take the two shots.
Oh, getting them together.
Yes.
Yes, no, that's been recommended. It's co-administration can be provided. You know, one in one arm, one in the other arm, if possible. And so you may have side effects from one or both vaccines, but beyond that, you're considered to develop a good immune response to both vaccines despite that, and no increased risk of side effects because you're getting two shots on one day. In fact, we often with vaccines, like for kids at 1 year of age, multiple vaccines are given at the same time.
Right, okay. And let's go on to another question that we see often. In your opinion, do you see the third shot becoming a requirement to enter restaurants and other facilities, similar to how we need two shots right now?
It's really hard to predict. I think in the next coming months, no, that won't be a requirement. You know, especially because not everyone is eligible for that third dose, or it's not required. I mean, again, the third dose is who it's being recommended to is to give that person their best protection because they may have a waning immunity.
Right. Let's go to this one. Is the third shot going to provide more protection against variants?
Yeah, that's a good question. It's hard to know. I mean, it's hard to know what variants. You know, there are a few that are under surveillance, like, you know, in the UK, ones that have been identified. BC yesterday said that they had this particular strain that was identified. And really, it's hard to guess where this virus is going and whether the vaccines will be less effective with the new variant. Again, the vaccine provides immunity to the spike protein. And so as long as there are variants, but the spike protein on that new variant virus is about the same, then the vaccines will probably continue to provide us with good protection.
Right, okay. Then, okay, can you clarify who is eligible for a booster shot as of right now?
Yes, absolutely. So if you have a weakened immune system because, you know, for example, you're a transplant patient or you're on particular medications like biologics or high dose steroids, well, then you're eligible for a third dose probably now, like probably your second dose was a few months ago. And so then you are eligible for a third dose. And it's considered in those people that a third dose is, you know, they need 3 doses where the rest of us needed 2 doses for our primary series. Mm-hmm. Long-term care homes or those who live in a congregate senior setting, so like a retirement home, they are eligible for a third dose. If you are 70 years of age and older, and you are eligible for a third dose 6 months after your second dose, if you had a full series of viral vector vaccine, so that means 2 doses of AstraZeneca or 1 dose of Johnson & Johnson, again, 6 months ago, you are eligible for a booster dose. And then finally, it's healthcare workers who had their second dose 6 months or more ago.
Okay, so that's everybody. Okay, one more question from YouTube from Jorlando. Does the city have the power to put in restrictions at those MLSC events, the sporting events where masking is not being followed properly?
Right now, the restrictions that are in place at sporting events, for example, are under the Reopening Ontario Act. Mm-hmm. And so those are the regulations that are being followed in those places.
Okay. This is a good one. And again, something that we've heard a lot. People are tired of everything to do with COVID-19. What can you say to people who are losing trust and feel like the goalpost keeps shifting when it comes to these vaccines? First, it was 2 shots. Now we're hearing 3 shots. People are sort of getting exhausted with that constant changing of goals.
Yeah, I mean, there's a lot of ways to look at this. I'm not sure that the goals are changing. Like, what we're really trying to do is to get out of the 4th wave this fall, to not have a burden on our healthcare system. Like, that has been our main goal, and that continues to be the goal. What we really want to see is that the COVID stops being a pandemic and starts being what we call endemic, like a virus like the flu, where you see a seasonality, it goes away and then it comes back. I think when you look at places like Alberta, they thought that they would try that. And they thought that they would try that, and it didn't quite work out for them. You know, when you let COVID go, it ends up having very severe consequences on your healthcare system. And so really that's what we're trying to get to, right? That is the goalpost that we're trying to get to. And viruses change. It's really hard to always predict it, but I think really recognizing that we want to keep people out of hospital from sick and dying from the virus, that fundamentally has not changed.
Right. This is a good one. How are at-home or isolated seniors being given the booster shots? Because this was a question when we rolled out the vaccine in the first place. So are there mobile units going door to door or something similar?
Yeah, that's a good question. Now, what we know is that most seniors are actually not eligible for their 3rd shot yet. Like, I think by the end of November or into December, most seniors will become eligible for vaccine. So those who are eligible now are certainly recommended as much as possible to get to a clinic, recognizing that there are pharmacies now have them. Many family doctors or have, like, over 100 of them have access to the vaccine as well. And that's another option that we didn't have in the spring. And many family doctors provide, for example, in-home service for a lot of people. So that's another option as well.
Okay. And then this is a question coming in on our website from Anand Kumar. He might have missed it. We just covered this. Are the boosters effective against the Russian variant?
Yeah, I haven't seen anything specific on, and I don't know which one is the Russian variant. Like, the WHO really has to classify it for it to be considered a variant of interest. Right. Versus a variant of concern. And really, like, the Delta variant was a variant of concern and has now taken over.
Right. But doctor, you mentioned, like, as long as the variant still has that spike protein, most of the vaccines would be effective against it, you said, right?
Yeah, so the coronavirus, SARS-CoV-2, has spike proteins on it. As long as that spike protein hasn't changed dramatically, then you will expect that the vaccine will still work against that variant.
Right. Okay, perfect. We just have 3 minutes left, and I'm going to quickly squeeze in a couple more questions. How can I check if my antibodies are waning? And if they are, will that make me eligible for a booster dose?
No, there's no way for you to check if your antibodies are waning. Again, those antibody tests that you can pay for to buy don't always predict how well your immune system lasts. I mean, that's one of the reasons why some of the tests that have been done measuring antibody levels or T cell levels, like measuring immune responses, don't always what we call correlate to not having a strong immune system. They have been used, but again, it's more than one antibody test. For example, in the clinical trials, they've used multiple ways to assess the immune response.
Right. Okay. Let's take this last one. If I am eligible for a booster shot now, where can I get one? Can I walk into a mass vax clinic? And what proof do I need to show that I'm eligible?
Okay, so the mass vaccination clinics in Toronto, for which there are 5 of them, will only give you a booster dose if you make an appointment. And so that's really important to know. You do have to make an appointment. You have to make sure that it has been 6 months since your last dose. If that's the case, then they will be able to look that up. That will be your eligibility. Don't go if your last dose was 5 months ago, for example, you won't be eligible. If you're eligible because you're immune compromised, you can bring a note from your doctor, have a form filled, even bring your medications. That will make you eligible as well.
Okay, and we have 1 minute, so I'm going to squeeze in this last live question that we have from our website coming in from Scott. Will people with CLL but not receiving active treatment be eligible for a third shot since they are immune compromised?
Okay, so the list of immune compromised is actually quite long. I believe you have to, if you have that's a hematologic cancer, have to be having active treatment for right now. Now, if you're 70 plus, you will be eligible based on age. And again, more guidance will come out based on other health conditions or age or whatever it is in the future.
Right. Okay. Okay, doctor. And that brings us to 1 o'clock. Thank you so much for taking the time and having the patience to answer all these questions. Thank you to everybody that participated and sending your live questions. That was really nice. Good interactive session today. We will be back with the doctor next week with another theme, but as always, we will take as many questions as come in. For now, we will say thank you so much and bye-bye. Thanks, doctor.
Bye.
Bye-bye.